My name is John Zoroyans. Everyone just calls me X because I have a long last name that starts with X. And I'm the Chief of Sports Medicine at Emory. Growth of the resident over the years is fascinating because you have people come in that we interview and we say, oh wow, that person's on it. You're giving all the opportunity where if you work hard and you want to learn and you want to be taught, you can evolve into anything you want by the end of the year, any level of trainer. And it's not always predictable. But if you put your nose to the grindstone, there's as much education available for you as you want.
My name is Janae Coles. I'm the Program Director for Athletic Training Residency Program. I'm always glad when I get this question. I really think what sets us apart, one, is the people. So we are a rather large program and we have a huge alumni base. And so that just means that we have a lot of people who care very much about the success of our program. And those people are involved with the program still. So I think that's one thing that sets us apart is the people that are involved with the program, and then also the value that Emory Healthcare holds for athletic trainers. That really helps set you up to expose you to a diverse patient population within orthopedics and great learning opportunities, a team of people that want to support you.
My name is Brooke Torres. I've been with Emory Healthcare for almost 11 years. I was a graduate of the Emory Orthopedic Residency Program for athletic training in 2019 and have remained a faculty member for the past 6 years. So one of my favorite things as a preceptor who has been through the program herself when it comes to teaching residents is being a part of their journey, being part of their growth process, both on a professional level and a personal level. Amongst learning how to interpret MRIs and how to scrub into surgery and the educational component of this program, we're also implementing throughout the year book clubs. We typically do crucial conversations in emotional intelligence. And for me, I really enjoy being part of that resident's growth trajectory. The people, the 5 residents that I have at the beginning of the year are not the same people when they finish the year. And it's just so cool to be a part of their character development. At the beginning as a preceptor, sure, you're doing a lot of hand-holding and guidance and giving advice. But at the end, it's more just getting out of their way and letting them be the clinical athletic trainer that they were always meant to be. And that's something that's really rewarding for me as a preceptor.
My name is Brian Baer. I've been a part of the Emory Athletic Training Residency Program for 9 years, and I work with one of our sports medicine foot and ankle and knee surgeons. So one of the things that I find challenging and rewarding is, as a faculty team and a faculty member, us trying to cater to the individual as they come in. So we spend a lot of time trying to figure out how to teach people individually based on their learning style, which challenges us as a faculty team to get the best out of them and make sure that they grow the most they can.
My name is Kyle Morris. I have been at Emory since 2022. Graduated from the Athletic Training Residency Program in 2023 and have stayed on and worked with one of our joint replacement surgeons up at Emory Johns Creek. I think a few challenges that I noticed coming out of the traditional setting and going into this residency program is the insurance and administrative side of things, which you don't really see a whole lot of. Working with patients, working with insurances, working with your pre-cert team and things like that. It takes a village to really get a lot of these patients the care that they need. And it also kind of just changed a little bit of how we go about being a clinician in terms of our evaluations and our recommendations. At the end of the day, you're trying to decide, does this person need surgery or not? So you kind of have to take a step back and look at it from that perspective, which is a little bit different than being in the traditional setting, but still making sure that you have what you need to provide those recommendations and get them the care that they need.
My name is Kelsey Melvin. I'm an athletic trainer at Emory. I love Emory. I went through the athletic training residency and I was really able to learn a whole new level of orthopedic care. Being able to be in the OR hands-on and learning from some of the best athletic trainers and surgeons in the world really taught me how much that they value us and how important we are to the Orthopedic Center.